Hello, good morning, good afternoon, good evening, depending on when and where you're watching this video from. I'm Dr. Katie, your radio home. There is something for us to learn today. Of course, that's why I'm here. Today we'll be discussing menopause, the problems of menopause, and how a woman can manage menopausal symptoms and live a beautiful life, a healthy life. All right? When you hear the word menopause, it's not a form of sickness, it's not a form of disease. It's just a normal transition in the process of aging of a woman. Every healthy woman, every normal woman will pass through the period of menopause. So it's not a sickness, it's not a disease. It's just that there are some symptoms, there are some feelings, there are some health issues that are associated with menopause that can be severe enough in some individual to need a medical attention and counseling. That's why I'm here today. I will try as much as possible to use words that are very simple. I promised you that it is not for the purpose of exam, and so I will be simple as possible so that you'll be able to understand and learn, gather information that will help you prevent disease or manage your health. That's why I'm here. Menopause. Menopause is said to have happened after 12 months of no menstruation in a woman. Menopause can be natural menopause or acquired menopause. Natural menopause is when a woman gets to the age of menopause and then stop menstruating, and then you say natural menopause. Why the acquired menopause? Most times this will come earlier than usual, earlier before the age that is expected for menopause. And this can be happening as a result of either the drugs that the patient is in, or the clinical condition that the patient is in, or the procedure, surgical procedures that the patient has had. For example, women who have had surgery to have removed their ovaries, they will attain menopause early enough. This is because the ovaries are the organs in the female body that produces the hormone estrogen and progesterone that is needed for normal reproduction as well as menstruation. So when you remove those ovaries too early, a woman can attain early menopause, which is now the acquired menopause. Women that are on drugs, cancer drugs, chemotherapy, radiotherapy, have been seen to also attain menopause too early. Women that are on hormone, okay, that like men hormone, trying to take the drugs for whatever reason, either for management of forms of disease or symptoms. So they take men hormone. For example, the testosterone, the androgens, the hormones that are meant for men. When they take such hormones, they are also seen to have attained menopause early enough. That's not menstruating now. Age of menopause. Age of menopause, if you have to take one, you say 51 years, but it's actually a range. Menopause can happen between 45 and 55 years, and every other one is out of this bracket. Then are rare cases that will be out of this age range that I've told you. Menopausal symptoms will happen perimenopausal. So it is important that we should describe menopause in terms of the periods that are associated with menopause. So we have the perimenopausal period, we have the menopausal period, and the postmenopausal period. Let me let you know that the symptoms that are associated with menopause is as a result of the decrease or deterioration in the hormone estrogen and progesterone that is produced by a woman. So when these hormones are dropping, the woman will begin to have problems. So these hormones actually starts dropping. These hormones, these two hormones I've talked about, actually start dropping at the age of 40. But some women are still able to get pregnant, all right? But at this time, the hormone, when the woman is above 40 years, this hormone will begin to drop. And so the fertility of a woman will begin to drop. However, women are still able to get pregnant within this period of 40, 45, or a little above 45. But the period or the process of menopause has actually started after 40. So when you hear perimenopausal period, what are the symptoms? This is when a woman's period will become irregular, either too much or too scanty, okay? There will not be increased pain. The premenstrual syndrome, women who used to experience pre or perimenstrual syndrome, they will have worse symptoms at this time. This is because the hormone will begin to drop, all right? They can have heavy bleeding. At a time, there will be no bleeding. They will have irregular menstruation. They will have their menstruation lasting for too long or too short. They have several patterns that have never been there before. And as this begin to happen, they are perimenopausal. So what are those symptoms that will be there at perimenopausal? There will be heat flushes. When a woman will suddenly have heat, as if the heat just came once, and she'll be sweaty. Before you know, it settles down a little. Before you know it, it settles again. And another time it comes up, that heat flushes. This will happen in perimenopausal women. It's a process of going into menopause as a result of the hormonal imbalance associated with this period. Another thing, the woman is also sweaty, night sweat. Perimenopausal women are seen to be sweaty at night. They sweat so hard. Their spouse will be saying I'm cold. They'll be saying I'm sweaty. With the fan, with the AC, everybody's cold. They are still sweaty. That is the problem with perimenopausal. Okay. The other thing, because of the drop in the hormone, the private part of a woman is dried. Normally, naturally, God made that place to be lubricated, to be wet, not a dry place. So during the period of menopause, that place becomes very dried, and so they can have a painful intercourse, and they can have a dry part. That part of their body is dried, and they cannot have a drop in libido. They will not desire sex. They will not want sex. At that time, they are highly irritable. They are easily provoked. They are hungry. Some will be anxious, and some people will have increase in heart rate. They will have dry mouth. They will have anxiety. They will have palpitation. There will be no good sleep, insomnia. They are not able to sleep well at night. Okay, and at this time they are not patient. They are easily provoked. They have mood swings, mood imbalance. You see them at this period. All right. So the purpose of this lecture is that as a woman, when you are around this period and you begin to notice these things, just know that this is what is happening to your body because of the hormonal imbalance. Don't take it too hard on yourself. Be gentle on yourself. Cancel yourself, number one, so that you can tolerate and bear to a reasonable extent the processes that are associated with menopause. But some women can be severe enough that they will have to need some medical evaluation and drugs to be able to manage the symptoms that are associated with menopause. Before we come to that, with help, let's finish the processes. Then after perimenopausal, where we have all these symptoms coming in, okay, then we'll go to menopausal period. Menopausal meaning that at this time it is established. There is no, that time we're talking about irregular menstruation, scanty menstruation, pain on intercourse and the other things. At this time, the symptoms will be seen to begin to de-escalate. They'll be less. All right, the heat flushes will begin to subside. The heart rate that was skyrocketing will begin to settle, and the mood swings too will begin to settle. At this time, the woman is at a higher risk of cardiac disease, heart disease. Is at a higher risk of osteoporosis, that is softening of the bone. Okay, before menopause, men are said to be at higher risk of heart disease. But after menopause, when the woman has attained menopause, the women are now at a higher risk of cardiac disease or heart disease compared to the men. Okay, at this time of menopause, the bones are softening, osteoporosis. Then we now have the postmenopausal period. The symptoms at this time is expected to have settled. All the heat flushes, the mood swing, and the other things are postmenopausal is expected to have settled. Postmenopausal means that the woman has passed 12 months, no menstruation, and now has done several years, usually between the process of 8 to 10 years. Okay, a process of 8 to 10 years where you expect the symptoms that are associated with menopause and perimenopause to have settled, and then the woman is said to be postmenopausal. So what are the problems that will not be there at postmenopausal? They can have nutritional deficiencies because of either inadequate intake from not very good appetite or not very good digestion and metabolism. At this age, they are at risk of cardiac disease. So a woman is advised to manage whatever comorbidity she's got, whether she's got hypertension, she's got diabetes, she's got excess blood fats, dyslipidemia, that's too much fat in the body. She's expected at this time to manage the comorbidity properly so that she will not put her heart at risk of cardiac disease or hypertensive heart disease when it is properly managed. Then at the postmenopausal, the bones are weak. So a woman is expected to take proper care of her bones. How do you do that? Good nutrition, all right? Fruits and vegetables. Early morning sun will help you with vitamin D. It is good that a woman that is postmenopausal, you take a gentle walk at least 3 to 4 times a week. And that gentle walk should be done within the period of 9 and 10:30, so that the morning sun will still be there, where she can actually benefit from the vitamin D that will help in the bone integrity and metabolism. And such women too are supposed to take food that is rich in calcium. Some will have calcium supplement especially when they are above 65 to 70. They will have calcium supplements that's rich in vitamin D. This is to help them with their bones. And some of them too will have to be on omega-3 or food that is rich in omega-3, omega-6 that will help in protecting the heart. And fish meal, when they take plenty of fish, it will be good for them at that age. So how is a woman able to manage perimenopausal symptom, menopausal symptom, and postmenopausal symptoms? For the perimenopausal, at that time, it is more acute. The body is still trying to accommodate. It is the beginning of the deterioration or decrease in the hormones, okay, in the body. And at that time, some women might not be able to tolerate the symptoms and they might need hormonal supplement. But my advice is that it is actually advisable that you don't depend on hormones to be able to manage the symptoms of menopause. This is because these hormones too, they have their side effects in the risk of cancers. And again, you are going to definitely stop the hormones someday and face the symptoms of menopause and overcome it. So earlier the better, while you face it and overcome it. So when you talk about those symptoms, it is advisable that for women who are having heat flushes, night sweats, okay, you advise them, take your bath before bed, take a cool bath before bed, and when you get to sleep, ensure that whatever it is that you're going to wear to sleep is not too thick. What am I trying to say? Avoid things that will make you sweat over the night so that you can enjoy the sleep. You don't need a blanket. You might want to put or sleep in a cold room. If you have the AC room, you have the fan room, you should be able to sleep in a cold environment. And if you don't have that and you have opportunity of living in a story building, you can open your windows over the night. Just ensure that you are sleeping in a cold room. It will help you have a good sleep. You know that you are also at risk. A woman that is menopausal, perimenopausal, is also at risk of insomnia. That's not having a good sleep, not sleeping well at night. So ensure that you take your bath before bed. Ensure that you sleep in a cold room, not a sweaty environment. You have a good cotton, light clothing for sleep so that you will not sweat. And then exercise. Exercise has been seen to help you have a good sleep. So institute routine, regular exercise as you age. You just do that 3 to 4 times a week and take good amount of water, drink water, rest well, avoid stress, anything that will stress you up during the day or even at night. And then try as much as possible to avoid quarrel with your partner, with your loved one, with your spouse, because this will further worsen your night sleep. And if you don't have a troublesome or a quarrelsome environment, with all these precautionary measures, you should be able to sleep well. And if you think that is not doing it for you, you can seek for counseling. You can get a support group. For example, people that have gone through that process and they did well, you can communicate with them. Get into one support group or the other where people will counsel you and help you go through the process of menopause. Adequate nutrition, fruits and vegetables will also help you go through the process of menopause. For some people, they will require hormone. Estrogens, women who don't have the uterus, some of them can use estrogen. You know why it is termed women without uterus can use estrogen alone to monitor or to control their menopausal symptoms? This is because estrogen will put a woman at risk of endometrial cancer. Endometrial cancer, when you hear endometrium is the innermost layer of the uterus. So for such women who don't have uterus, they will now say that the risk of endometrial cancer is reduced to the barest minimum. But for women who've got a womb, it is not advisable for them to use estrogen. They can use estrogen alone. They can use estrogen and progesterone. But there's still risk of breast cancer associated with that. So the risk of cancer with hormonal supplement post-menopausal, it's the reason why the treatment with hormones are not advocated all the time. So if you are able to manage your symptoms, or your symptoms are not interfering with normal life, it is advisable to just go through it and take the necessary support for people that have gone through it, adequate nutrition, lifestyle changes, and lifestyle modification that will help you go through it. Of course, you should not be seen to be abusing alcohol at that time. You should not be seen to be smoking tobacco. So this healthy life will help you go through it. And then you have to prevent the risks that are associated with the menopause and postmenopause, the risk of cardiac disease, the risk of osteoporosis, by adequate nutrition, adequate exercise, morning sun, food rich in calcium, vitamin D, and then clinic follow-up if you have any comorbidity, so that you can adequately manage your comorbidity and live otherwise healthy life. Hope you have learned something. That's why I'm here every day, to ensure that you have information to prevent disease and help you live a healthy life. Thank you. I want to tell you something in case you that is listening, you're a doctor. I have a YouTube channel that is titled Anesthesia and Intensive Care Made Easy. In that part of the YouTube, that is where the stuff is being dished out, okay? In a simple way, in a unique form that you've never seen before. You know what happened in that case? In that place, we have mnemonics, we have short forms that will help you understand and memorize a lot. So you tend to learn a lot in a short period of time. Anesthesia and intensive care made easy. We have lecture notes there. We have procedures there. We have case reports of cases that we have done that we felt is worth sharing with the public, how we're able to have a success, because how we're able to have success based on the clinical condition that the patient was. We felt it's worth learning from. So we'll put it up there. Procedure, we'll put it up there. And I promise you, it will never be a dull moment there at Anesthesia and Intensive Care Made Easy by my humble self. Have a great day. Bye.